Welcome to the video that provides you some tips as you administer the first grade eNumeracy diagnostic screener. As you look at the examiner score sheet, you may notice towards the top a hesitation rule, that if a student doesn't respond within 10 seconds, to move on to the next item. Use this as a guideline to relieve student frustration, not cause it. Hesitation could occur for any number of reasons. If you see a student hesitate for 10 seconds, ask them what they're thinking. If what the student is thinking is way off the mark, then utilize the hesitation rule to simply move on to the next item, saying, let's try this one. If the student says, I don't know what to do, then clarify the directions and try again. If the student is still unable to respond, utilize the hesitation rule to simply move on to the next item, or perhaps even the next section if the student is that frustrated. If the student responds that they are still thinking about their response to the item, give them a bit more time. If their answer is accurate, keep in mind that this particular student may simply want or need a bit more time to process. That's useful information to know. Don't cut them off just because it takes them longer than 10 seconds. The purpose of the hesitation rule is to relieve frustration, not to cause it. You also notice that in each section, the approximate amount of time is to be recorded. This can be overwhelming for a teacher trying to count time as well as record answers and note what you observe about the student during the assessment. Try to record the times in each section for your own information about the relative fluency of your students on each task. But failing that, at least record an overall time for the examination as a whole. Don't stress about it, but make sure you have some information about how long it took your students. To give the whole assessment at once or not. The examiner score sheet is two-sided and is divided into 10 sections. Each section stands on its own and can be given separately. The benefit of breaking it up is that it takes smaller chunks of individual days. However, that's a lot of transition time, getting students to and from your kidney table for just a few items. The main thing for you to know is that you don't have to give the entire screener in one setting. You certainly can, and the screener was designed to be able to be given in a single sitting. But if you find yourself pressed for time, and think you can do maybe 2 or 3 sections or just one side of the page, with a series of students at a stretch while their classmates work on something else, then you can certainly exercise your professional judgment in how and when you screen your students during the window. Using manipulatives. Kindergarten teachers who were early adopters of these materials in the 2017-2018 school year provided feedback that while they love having everything in one place with the binder, they felt they could get better information about their students if students actually had physical counters to touch for all the sections instead of pointing to count two-dimensional dots, for instance. Whether or not an individual student needs tactile stimuli to be able to engage in a task is useful information. Try it with the binder as is first. If you have a student who's not able to engage in a particular section or sections, use your discretion. Try similar tasks again and use more tactile means with them. Some possibilities include 2-color counters, number lines, numeral cards instead of the 4 numerals in a square, and using a paper to make a window to reduce how many numbers are seen at once in the number recognition section. If the student is able to productively engage in the task with the manipulatives when they were unable to do so with the binder, take that information into consideration as you analyze your data. The student might not need an intervention beyond Tier 1. If you have further questions, ask your learning liaison. If he or she doesn't know, we'll make sure that we get the answer to you.